Hello everyone, welcome to my channel. Today we have another psychiatry question for step 2. If you would like to see more step 2 questions, please like and subscribe. A 46-year-old woman is evaluated in a primary care clinic for chronic abdominal discomfort that has been present for nearly 3 years. She describes episodes of cramping, abdominal fullness, and occasional nausea that occur several times each week. The discomfort has affected her ability to work, but she has difficulty identifying a specific location or a consistent trigger. The symptoms do not appear to be related to meals, bowel movements, or physical activity. Over the past 18 months, she has visited multiple urgent care centers and gastroenterologists without receiving a diagnosis that explains her symptoms. She says she feels frustrated because everyone thinks I'm exaggerating. During the review of systems, she also reports chronic fatigue, tension headaches, diffuse muscle aches, poor sleep, frequent urination, and intermittent dizziness. She intentionally lost about 3 kilograms, 7 pounds, after changing her diet to improve her health. Her temperature is 36.9, 98.4 Fahrenheit, blood pressure is 122 over 74, pulse is 76 per minute, and BMI is 24. Abdominal examination reveals mild generalized tenderness without guarding or rebound. The tenderness noticeably decreases while the patient is engaged in conversation. The remainder of the examination is normal. Previous evaluation, including a complete blood count, comprehensive metabolic panel, inflammatory markers, thyroid function tests, abdominal ultrasound, and upper endoscopy, has been unrevealing. After reviewing the findings, which of the following is the most appropriate way for the physician to begin discussion with the patient? Okay, so first things first, we need to think about the diagnosis. The patient thinks she has some sort of illness, but that's contrary to what the lab findings and the physical examinations show. And this is a typical sign of somatic disorder. You believe you have an illness, but you don't actually have that. It's a psychological issue rather than a biological issue with your body. With that being said, let's think about the best initial statement that we can have as the provider. A. Since all of your testing has been normal, your symptoms are probably caused by emotional stress. This is not the best way to start the conversation because, first of all, we are dismissing her concerns and we are talking about more emotional uh, concepts and matters that might not be the best way to start a conversation because they think something might be wrong with them. B. I see that these symptoms have been difficult for you. The reassuring news is that your evaluation has not found a serious medical illness. This could work because we are not really dismissing her concerns and we are providing a good news, which is a good way to start a conversation. C. Your symptoms seem to be psychological rather than physical, so additional medical evaluation is unnecessary. We don't want to say this, similar to A. This sounds dismissive. D. Your symptoms are most consistent with somatic symptom disorder, and effective treatments are available. Again, we don't want to talk about the somatic symptom disorder initially. We want to save that for later. E. Because no disease has been identified, meeting with a mental health professional should be the next step. This could be the worst choice because first we are dismissing her concerns and also we are uh, quickly referring her to another provider. And this is not something we want to do because they feel we are avoiding them, which is not the impression we are looking for. With that being said, the correct answer choice is E, B. Thank you very much for watching and don't forget to like and subscribe.